Bismillah ar-Rahman ar-Rahim. This is a quick speak about vitiligo. It's a common disease affecting many of the Jordanian population. So you really need to understand how we manage this type of disease. Vitiligo is an acquired skin depigmentation that affects all races, but is far more distinguished in blacks. We don't know the precise cause. There's a genetic factor. 20 to 30% may have a family history of such disease. Pathophysiology is unknown, but it's look like it has an autoimmune autoimmune process directed against the melanocytes, and this is the characteristic part of the story. There's an immune reaction against the melanocytes. So the patient will, this is the patient hand. It will look like this. Why is this happening? Because part of his melanocytes are disappeared of melanocytes and interruption of production of melanin, and that's maybe it's an autoimmune. How to this type of disease quickly? We're gonna go to the anti-inflammatory reaction that gonna reduce the inflammation and autoimmunity. So we were gonna use the corticosteroid, topical corticosteroid, to reduce the vitiligo, and we're trying to and that will encourage the reproduction of melanocytes within the area. So corticosteroid is a drug of choice in many cases of vitiligo. So vitiligo, the treatment is corticosteroid. They're gonna inhibit the autoimmune reaction against the melanocytes and will reactivate the melanocytes to come up toward the to come up again and produce melanin again and again and reproduce. In many cases that will not really be very effective, especially if the vitiligo is very severe. So we may use other drugs. Topically, we use something called calcineurin inhibitor and calcineurin inhibitors like tacrolimus, and that type of drugs becoming as a cream, and that type of drugs inhibit a very interesting molecule within the cell called calcineurin, and that will inhibit very interesting cytokines called interleukin 2, and interleukin 2 has a very is very effective in gathering the other T cells and so forth, so on. So it's an autoimmune inhibitor, if you like, or a T cells inhibitor. This is the calcineurin inhibitor, has a good activity. If we really not successful in this, maybe before or after using calcineurin, we may use the ultraviolet light. It's similar to that ultraviolet light that we used within the psoriasis. So either solarine, we use solarine ultraviolet light, or ultraviolet light alone. However, remember there's a irritation, there's a burning sensation, there's a side effects for using such type of treatment. Sometimes at the end of the day you may use this type of treatment. We call it dyspigmentation therapy. Dyspigmentation meaning you remove the pigmentation, so you remove the melanin and you try to reduce the activity of melanocytes to produce melanin by a drug called hydroquinone, and hydroquinone will remove the skin or remove the color of the skin and make it like depigmented skin, and this is the sometimes one of the choices that you're going to use if you fail in treating vitiligo by the corticosteroid and the calcineurin inhibitors and ultraviolet light. And thank you. This is a quick story about vitiligo.